Oh, I was my baby, you're from Calabos. The only boss. With oneness. They be me will be everywhere a day and everywhere they go. Tap Send got me covered. For if you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through Tap Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download Tap Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download Tap Send. Okay? But also, when I receive my money, the other time they were with him chilling, like my view, no, hey, you crazy.
Download Tap Send now on Google Play and App Store. Tap Send. It's secure, convenient, easy, and fast.
Buy an interest-free home and pay within 36 months. Yes, Daimler Homes' new gold standard development, Hilton Court, has just commenced, and you can own a unit now and pay within 36 months without any interest. Starting at 95,000, you can own an elegant apartment. And guess what? Discounts are available from now till end of May. To learn more, visit our website at daimlerhomesgh.com or call us on 0200 584 558. Daimler Homes, the elegance of living.
A-class, we patch out, we did this over here. Tima and to tap for my say situation I'm a kuno and yes I know pay na you did say set biano mobile firm through na bibia be boko now so yeah customers need the idea in fact and yeah the idea but mama a holiday inti you better must for this 1 month holiday amodi amaye it's as say yasuma do yen kakra your excuse will be fra. They can't say tap for problem. So until say problem no best sort in a 8 minutes and DBVM. And here that was for the holiday. Even though say yeah they pay and abano. Entity 1 and 2 or more. But situation be a muku biano. Yeah, transfer mobile na ya start to you must say this no. I start with tap. Thank you.
Tap Send. Papa no.
Hello, and good evening, everybody, and welcome to the OT Health Talk Show. My name is Abna, and I'm here with Dr. Akos, and together we form the Oasis. So today, Dr. Akos is doubling as both a host and the presenter of the show. The presenter who's going to give us the speech, the talk. And this month, we are doing men's health. So we're focusing on we'll let Dr. Akos introduce the topic later, at a later time, while I've done all the housekeeping things. So to start, I want to thank Tap Send for sponsoring the show, who's our sponsor, and OT Health Talk for making this show happen. And we also want to thank each and every one of you for joining us today. So, Dr. Akos, without further ado, will you introduce our topic for the night?
Avec plaisir. So, yeah, everybody, hello. Thank you for coming and being here on time. Today, we're going to talk about basically infertility, but we're going to concentrate on men. So November, or also known as Movember, is basically Men's Month. So this is men's. Yesterday was actually Men's Day, and it's such a shame. And I always say this: I've got a son, and I hope that someday somebody celebrates him. But men don't really get celebrated as much as women. And you know, Women's Day is really put out there, but I think a lot of people do not even know that yesterday was the day to celebrate a man. So if you didn't know this and you didn't do it, make sure you message somebody, a man in your life, either your father, you know, your godfather, whatever, your husband, brother, and and just tell them how much you appreciate them. But November is also the month which is basically males month, and it's usually males men health awareness month. So this month we're going to cover a lot about like men's health. We're going to start off with infertility in men. So yeah, that's the topic for today.
Sure, excellent. So, so you heard it here first. Please invite a man to come to the show so that they can be blessed by our doctors. So, Dr. Akos, how would you want this to run? Do you want a presentation, or do you want a question and answer?
Yeah, I'll do a quick presentation. Let's have a look. If my presentation is here, I'm going to try and I'll share my screen in a minute, but I just want to give a quick introduction. So infertility, a lot of the time, when you think about being infertile, most people think about women. I think especially in the African sort of setting, I've had countless of stories where a lot of people would be like, oh, you've been married for 2 years, 3 years and not had any kids, and everybody tends to turn to the female and be like, oh, she's barren, or things like that. But the hard facts are that actually statistics show that 40 to 50% of infertility cases involve male factors. So a lot of the time, actually, women, it's actually half and half, isn't it? So 50% of the time it's the woman who's at fault, 50% of the time it's the man who's at fault. So and again, I don't want to say it's our fault, like it is somebody's the one person to blame. But when I say at fault, what I mean is the problem is actually coming from the man or the woman, and infertility is no one's to blame for it. It's just a genetic thing. Some environmental factors also play a role, and I'll come to that in a minute. But yeah, it's just to know that we don't point fingers when it comes to infertility. So to make this a little bit, it's a bit of a complex case. I'm going to break it down. How I'm going to do that is I'm going to talk about a case. So I'm going to use a case study. So this is a dummy patient. So it's not a real patient. But if it does sound like somebody or something, it's because the stories are often quite similar. And a lot of patients I see will fit into this kind of criteria, but it's not a person I know. Or it's not a real person, it's a dummy case. Okay. So there's a 43-year-old male who's got a daughter from a previous relationship. He's met a new partner who's about 45. She's got 3 children, a mix of sons and daughters. And they want to have kids of their own. They want to come together and they want to conceive. So essentially, they've been usually to say somebody is infertile, they would have had to be trying for more than a year. But given their age, because they're above the age of 40, even if they've been trying for about 6 months and they're not able to conceive, we would usually refer them to sort of infertility, because the longer you wait, when you're over the age of 40, it's harder for you to sort of conceive. And the longer you wait, if you say we're going to wait a year, by the next year, the man's going to be 44, the woman's going to be 46, and the chances are going to be even lower. So when you're above the age of 40, usually we give it about 6 months. So, and then when we say trying for 6 months, you'd be surprised to know this. The amount of people who come into the GP and we ask them, have you been trying? And they say, yes, we've been trying. And then we'll say, okay, how many times have you been having intercourse? And they'll say, oh, maybe once a week. Or not even that, maybe once every 2 weeks. If you're actively trying to conceive, you have to be having sex every day. So that's usually what we say. When a lot of people say we've been trying and they say, oh, we've not been doing it that often, we say, okay, go back and try and do it every day. I know it's a bit of a faff when you're married, that's a bit of a stretch, but if you're trying to have kids, you do have to put in the work. So yeah, so they've actively been having sex every day for the past 6 months and still not able to conceive. So came to see the GP, and then basically we take it from there. The man's past medical history, aside, he doesn't smoke, he doesn't drink, his BMI is fine. He did have something called a varicocele repair about 2 years ago, which is basically when you've got a bit of a swelling in your testes. But that was all repaired, that was all fine. So no reason why he shouldn't be able to have kids now. So the first thing we do is we refer you to the infertility clinic, and then we also do something called the semen analysis. So we send off, and the way you do the semen analysis is we collect the sperm in a bottle. Well, not we as in the GPs. This will be done with the infertility clinic, but just to give you a rundown of how it works. The semen will be collected in a bottle, and then they will analyze it essentially. And here is where I'm trying to share my screen. So I want to share the sort of results that you get with that. And oopsie daisy. There he is. Okay, 1 second. So once the semen analysis is back, the person should get something like, let me know if you can see my screen in a minute. It's loading. So can you see the screen?
Well, we can see, no, it's black. Oh yeah, now we can. Yes.
Okay. So basically, the main things we look out for are these three things. The first one is the sperm count. The second one is sperm morphology, and all that means is basically the shapes of the sperms. And then the third one is the sperm motility, and that means how the sperms move. So essentially, the normal count of the sperms in one ejaculation by a male should be about 15 million sperms in one ejaculation. If it's less than 15 million, it is known as a low sperm count. So even if it's 14 million, it is a low sperm count. And if it is even like 10 million or 1 million, it's all under the same. So it's known as a low sperm count. And this is how you would see it in sort of a petri dish. So if it's a lot, you will obviously see it like this. If it's low, it'll be like that. But again, they'll count it and they'll know how much it is. Then when we talk about the shape of the sperm, so a normal sperm should look a bit like this, a bit like a light bulb with a tail. And some sperms have weird sort of shapes. Some have chunks missing out of them. Some have 2 heads. Some even have 3 heads, different types of shapes. So you can have 15 million sperms or more than 15 million sperms, but if they're all shaped like this, essentially they're a bit useless because they don't fit the criteria of what they're supposed to be. So again, that would be something that would make you infertile. Even though your sperm count is normal, the shape is important. And the third thing we look at is the motility. So the sperm, again, like I said, should be a light bulb, should have a tail, and should move upward. So in the upward, we should climb uphill. You know, if the sperm starts sort of swimming sideways, going a bit left, and some sperms go around in circles, and some go backward, you know, instead of climbing the tube to heaven, they're going down to hell. It's a bit, you know, it's just going in the wrong way. So the sperm motility is also important. So again, you can have all the right things. You can have the 15 million, you can have a normal sperm shape, but if your sperms are not going in the right direction, then, you know, something's wrong and something needs to be done about it. So I'm going to stop sharing my screen there. So this is basically the 3 things that we have a look at. So this gentleman came back and he had all these 3 things wrong. And I'm going to start mentioning some big names because the sperm count has a name. And if you have low sperm count, it's okay. You don't know. There's no point in mentioning the names. It's irrelevant unless you want to know it. They're funny names actually. Okay, fine. Low sperm count is called oligospermia. Low sperm motility is called athenozoospermia, and abnormal shape is called teratozoospermia. So they've all got funky names, and you get you get the results back and you see all these things on it and you're thinking, what does this even mean? So a lot of the time the GPs have to call the patients and actually explain what all these results mean to the patient, because some of the patient results make no sense whatsoever. Okay. Now, hold on a minute. I'm just trying to allow some people in the waiting room. Give me 2 seconds.
Could I possibly made a host so I can take care of that so that you can focus on your...
Yeah, no, sorry, I don't know how to do this. I've just done that. That's fine. I just realized there were 7 people waiting in the waiting room. So I'm just going to...
Yeah,
fair. So then what happens after we get this, the results back? So we sort of start to discuss what kind of management we usually do. So a lot of the time we do 2 sperm analysis. The first one, if there's something wrong with it, we wait 6 months later and then we repeat the sperm analysis. And the reason we do that is because there are some factors, environmental factors, which can affect sort of sperm morphology. So, and things like sort of age, number one. So the sperm quality and quantity of your sperms do decline with the older you are. And that's why a lot of the time we advise people to have children, if they want to have children, sort of below the age of 40, because that's usually when we know the older you get, actually even the older you get sort of past 35, you can start having problems with this. But if you hit the age of 40, then sort of the problems, the percentage of that sort of triples. So that's what we usually say. Especially advanced paternal age, which is the man's age, can affect the DNA integrity, which increases the risk of miscarriage and sort of genetic abnormalities. if you remember, I said that the gentleman had a previous repair of his balls because he had some swelling in his balls. Oh, why is Abena entered the waiting room? What happened to Abena?
I'm certainly not the only Abena.
Oh, it's not you, okay? Okay. Okay, so while having a previous surgery on your ball, so things like testicular torsion, which we'll talk about later, that's like an emergency surgery for men. So that's when your balls sort of get twisted around. This can happen with sort of heavy lifting, ibuprofen, that sort of thing. And again, STIs, so sexually transmitted infections, which then gives you something called orchitis or epididymoorchitis. So that can also cause, so that's just inflammation of sort of your genital region in a man. That can cause problems as well. So all these things can cause issues. And if you've had any of those sort of infections or any surgical repairs of the male genitalia, then that can cause some infertility problems. So obviously this gentleman had something in the past, which could again have affected his sperm production. Sometimes it is genetic factors. In this case scenario, if you remember, I said that the gentleman's partner had 3 children. So her fertility is likely to be intact because he's only had 1 child. It's more likely that he's the one causing the problems. And especially he had the child and then he had the surgery. So we could say maybe after the surgery's actually affected his ability to have children, to make good sperms. So usually we can do some other tests as well. We can test for hormones and see again, because we know that hormonal imbalances can cause infertility in men. And then as I talked about genetic testing, and then other imaging tests. So we can do like an ultrasound of the balls to make sure that he doesn't have anything wrong, so any other infection, any other problems in the structures of the male genitalia can cause abnormalities. And then the very last thing we do, sometimes we do DNA testing, again, just to check the integrity of the sperm and the DNA in the sperm, because that can be a huge issue as well, because you could be producing what looks like normal sperms, but then the integrity of the DNA can be wrong. And if that's wrong, that usually affects the shape of the DNA of the sperm. So this is something that we test as well. How do we manage this? So if you remember, I talked about some lifestyle changes. We know that environmental factors that can affect fertility are things like smoking and alcohol. So smoking causes things like free radicals in the body, which then attack your cells, your DNA. They can change sort of DNA regulation, which can again affect the sperm production and the cell makeup, the DNA makeup of the sperm. So smoking is a huge one that we usually advise people to stop smoking if they've got anything wrong with like their sperm analysis, and stop alcohol. Again, obviously for us to retest it in 6 months' time. Weight management. So we know that having a higher BMI or being obese can also affect sperm production and things. And I can get into that, but it's a lot of detail. It involves heat management, fatty acid. There's a lot of like genetics and science in that. So I'm not going to get into that. Another thing we also usually advise people is to take vitamin-rich diets. So as much as eating lots of fruits and vegetables, we also say supplement with antioxidant-rich vitamins like vitamin C, vitamin E, selenium, zinc, coenzymes 10, so CoQ10, I think is what it's called. These all improve like sperm. So I even always say, if you know that you're a little bit older and you're trying to have kids, even before you start doing this, you can start taking these vitamins. Actually, even before you hit there, I mean, even now, I would always say, if you know you want to conceive in the future, just start taking some of these vitamins, because they can sort of help build up sperm production. And then another thing is reduction of stress. So we do psychological counseling or mindfulness techniques. The funny thing is almost a vicious cycle. So the more stressed you are about having kids, the more the stress can affect your hormones, which means that you have a less of a chance of producing healthy sperm. So stress in itself can cause issues. So usually we offer some guidance on counseling and things. There are other techniques in which we use. I'm not going to go into all of those details because we don't have enough time. But the one thing I want to say is there is a way to get around this. If you get tested the second time and your sperms are still abnormal in one way or another, there's several things we can do. So I know if anybody's heard of sort of in uterine insemination. So usually that's only an option for people who like, let's see. So if it's only the male who is, let me see think. I'm trying to think, how does it, or if it's only an option for a male who's got male factors. So if you inseminate in the sperm, that's it. Obviously if it is there's a problem with motility and there's a problem with sperm count. But if there's a problem with morphology, the shape of the sperm, then that's really not an option. There's also in vitro fertilization, which basically you just need one sperm for that. So even if you have low sperm count, if I know some people who have, like, let's say they have 5 sperms left, you can still uh, um, you can still give birth with this technique, because all you need is one sperm. You just take out the sperm, you put it in the woman's egg directly. So it takes out all those factors of the sperm having to swim and all those things. But again, the shape has to be right. So if you only have 5 sperms and all of them have poor shape, then unfortunately this can't be done, because the shape of the sperm is very important, because the shape of the sperm is determined by the DNA of the sperm, and an abnormally shaped sperm is just not going to create a viable life. So yeah, that is sort of the options that people have. And then there's something called testicular sperm extraction, which is in very severe cases. The sperm is directly retrieved from the testes, and again, it's used in several ways to try and get the woman to conceive. So there's sort of many things you can do, but a lot of the time as well, we test the woman as well. So whenever anybody's having difficulty and sort of with infertility, we don't usually just test one partner, we test both. So we'll test the female as well and the man. So sometimes there may be some factors as well in the female that, even though the female might not be infertile, but if some factors are tweaked in the female, then it might be able to help the sperms move in the better direction. So again, something like pH, infection in a woman. Sometimes they say there are cases where a man and a woman are just not compatible when it comes to the sperm, the environment of the woman to the sperm. Again, these things can be looked at, and again, these things can be obviously can have a look at those things and try to make those more favorable environment for the man's sperms. So I think that's pretty much all I'm going to touch on today, because I'm mindful I can't go on forever about this, and there's so many factors that affect male infertility. But the one thing some of the things I want you guys to take away from this is that, number one, the thing that causes sort of male infertility is the advanced age of the man. So again, about being over the age of 40 is a big thing, because it can change. There are lots of things that happen at the age of 40 and changes that happen. And yes, I know there are male men at the age of 70 who are still having kids, and that is possible. But some people, genetic factors, environmental factors, so that's something to look out for. But even if you do have infertility, or if you've had semen analysis and there's something wrong, there are ways in which we can go about that and still help you conceive. And the good thing about the UK is this will all be done on the NHS. I think, aside IVF, which I don't think is on the NHS, but even with that, I think for people who are infertile and don't have any children, there are some government subsidies. And if any specialist infertility nurse or doctor is in the chat, you can keep me right on that, because I'm not entirely sure. But I think there is something out there for people, first timers who want to have kids on the NHS. And the holistic approach is usually used. So addressing lifestyle changes, genetic changes, psychological changes, these are all important, making sure that we turn the tables when it comes to infertility. So these are the 3 things I want you to take away from this talk today, and I hope I've not bored you to death.
Most certainly not. Thank you, Dr. Akosua. As ever, for those who just joined, this month is
male infertility.
No, this month I'm talking about.
Oh men health awareness. Yeah,
is Men Health Awareness Month, and so this month, as we've done previously for mental health, women and breasts and all of that, we will be concentrating more on sort of men's health this month, and we kick off the month with infertility in males. And Dr. could just run us through the causes of infertility, some of the holistic approaches to it, what some of the things, factors, how to counteract them, what to do, and all of that. So we thank you very much, Dr. Akos. So if the ladies in here for the rest of the month, could you please bring one male with you so that we can they can benefit from these health talks. As per usual, we will go on a break. We'll go on an ad break, and then when we come back, we will take any and every question, any health question that you have. So see you soon.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.
Hello, and welcome back. So, as mentioned, this month is Men's Health Awareness Month. Yesterday actually was International Men's Day.
Yeah.
So we just want to celebrate our men. We say thank you guys for being our protectors, our leaders, our guiders, and for all that you do for us. And all that you do for us. So celebrate a man today if you didn't do it yesterday. So to kick off our month, Dr. Akos talked us through male infertility, and now we are at the Q&As session. You can ask any and every question. Doesn't have to relate to today's topic, and it most certainly can relate to today's topic too. I kind of wanted to kick off with we've got a question in the chat. I think it's talking about. It's free on the end. Oh, it's not a question on the end.
So I just quickly checked as well. And basically, I think there are some very strict parameters that you need to meet. There's a strict eligibility criteria, and you have to have had 12 cycles of artificial insemination within at least 6 of the, there's quite a lot of eligibility criteria for it. So a lot of people I know have just kind of gone privately with it. But apparently it costs something like £5,000 privately for just one session. And we know that IVF is not always successful on the first round. I know people who had to try 2 or 3 times. So it is quite expensive. But I guess if you have the patience to wait on NHS or you don't have the means to pay for yourself, then I guess you just have to fit a really tight criteria. And it says you have to have been trying to get pregnant for 2 years through regular unprotected sex. And again, that can be challenging for people who are over the age of 45. 2 years is exactly it's almost like the more you waste time, the more. So I know a lot of people who might just then go and just have it by themselves. Somebody messaged me directly, and I think this was when I was talking about regular sex being every day. And they said, Dr. Akos, every day.
That was the question I was going to kick off with and say that you said that that when you are married, it's a problem. So I was going to say, why? I don't even know if this is a medical question, but why do you think it is that it's when you're not married, you have sex, or people who are not in marriages, partners find it easier to have sex more often than when it's a marriage?
I don't know. I suspect, I'm not sure, because I guess we'll have to ask the same question to a couple who maybe cohabitate to see, is it the fact that living together makes it? We always say that you always don't know what you have until you lose it, or was it maybe maybe when the person is around all the time, or if you're, but well, in my experience, it's not about being married, it's more about have the kids side of things. So when you've got kids, and it's like, you obviously, by the time you put the child to sleep and you're tired and stuff, then it becomes a bit of a struggle. And and if you especially if the child is sleeping in your room, and there's a lot of politics around it. But I think if you're not married, if you don't have that and you're married, and it's a bit of a struggle. And I think it's often the case of, because when you're dating, and let's say you have to put in a bit of effort, don't you? You have to get dressed, go meet the person, go to the person's house, all that stuff. And when you're there, you're only there for a short time, so it's like or whatever it is. But I don't know. Somebody else can answer that question. I'm not experienced enough in marriage to answer this question. So yeah,
just that observation. Interesting. Yeah. It seems that we're very short on questions today. Maybe do you have anything that you would like?
Well, I think it's because I'm talking about male fertility, but I can also answer questions on female fertility. So if anybody's got any questions, and I can answer questions on anything as well. So if anybody's got any other questions they'd like to ask, more than happy to answer.
Oh, we've got Auntie Amma. Please go ahead.
Good evening.
Good evening.
Sorry, I joined late. I was logged out. I don't know how, but I managed to join. I had to call Anakwame. My question is, do you still give Clomid to females who are going through infertility?
What was the name of the drug?
Clomid.
Yes. Yeah, we do. We might not give, and I think, so Clomid, well, I'm guessing we give clomiphene citrate, and I think it's the same thing. And yes, we do give it. We give it to men as well. So we give it to women and men. But again, it depends. So this is more of a specialized one. So me as a GP will not prescribe this. But I definitely have patients who've come back and have had that given by the specialist in the past. So the fertility specialist, they have several things that they give. And I know that that's definitely one of them. And I think they still use it unless things have changed in the last year or so. But I know that I've still got patients who are on that. Yeah.
Okay.
Why that particular question?
Yeah. The reason why I'm asking, I suffered infertility for 15 years.
Okay.
Before I conceived, but I was given. I had all the treatments except IVF, which I was told that wasn't going to work for me because I had a severe type of PCOS.
Okay.
Yeah, and I know they've linked infertility to diabetes to infertility. Can you throw more light? Because I've read quite a few literatures, and is it true?
So diabetes, if you think about diabetes, can be pretty much linked to everything, anything and everything. And the reason for that is that when the simple sort of explanation of the way in which diabetes is basically extra sugar in your blood. You think about the extra sugar in your blood, the blood works as the motorway to all parts of the body. So when you've got extra sugar in your blood, and the thing with diabetes is you don't have enough insulin to be able to sort of digest or absorb these sugars from the blood. So the sugars just go roaming around the blood. And because the blood is a free highway for the whole body, the sugar is able to get everywhere. It goes to your brain, it goes to your eyes, it goes to you. And this is why when you've got diabetes, we usually check every single system. You have an annual eye check, you have annual feet check, you have heart check, because the sugar is going everywhere indiscriminately. And even though there's something called the blood-brain barrier, which is the barrier which stops infections and things getting into the brain, we were made specifically for this. And actually the body is a beautiful design. If you learn anatomy, I know that some people might not believe in God, but the body alone is a reason to believe in God, because the body is made so specifically that there's a barrier between the rest of the body and the brain. So you can have an infection like sepsis, which affects all of the body, but the blood-brain barrier acts as a very protective barrier, which protects your the rest of the body from the brain. However, with sugar is one of the structures that the brain actually uses to work. So sugar is the only one of the molecules that can cross the blood-brain barrier. So diabetes can also affect the brain in a way, because that's the only molecule which can actually cross this barrier. So back to your question on how does diabetes affect infertility? Well, that's because your blood vessels in your genitalia, especially for men, is affected. The less blood you're getting to the scrotum, to the vas deferens to make the sperm, that means you're getting less nutrients to the sperm, which means the sperm are starving, which means that the sperms that are being produced, are basically malnutrition sperms, is going to affect their shape, is going to affect their motility, is going to affect the number. And the same with the females, the blood getting to the ovaries are basically, it's got sugar in the blood, it's affecting the blood. So diabetes affects everywhere in the body. So I hope that answers your question. Obviously,
thank you for saying that. Yeah, thank you for saying that, because I did a lot of research into diabetes, and in most of my health talks, I always say to people, especially when I'm talking about cancer, I always just say to people that people are, Black people are always scared of cancer. They don't even want to mention the name cancer, but I am not scared of cancer. I am scared of diabetes than cancer, because diabetes affects every part of the body. And I'm happy that you've actually confirmed what I said, but I've been saying. So, in view of your explanation, yes, it does affect because of But looking at the type of food we eat, because the reason why I'm saying that is, I know a couple of couples young couples who married 7 years, 8 years, 10 years, and they are still struggling with their fertility. And 2 of them have been told that is the meal. When you look at the food that we eat, the fast food, most of them are just sugar. So pardon? Indomie, thank you. The fast food, and when you are educating, when you are talking to these young ones, they don't seem to just understand, because the food that you eat, you are what you eat. But if you keep on eating fast food because that's the easiest way, then you're going to pay for it in later life. And it's so sad that I think about in October, first week in October, I attended a wedding and I saw a guy who, he got married to this young lady for the past 7 years. And when I asked them, they've divorced. Yes. And I was so shocked. But I met the lady, I think somewhere late last year, who, she said to me that things are not going on well. And I said, I've been praying, I've been waiting for my grandchildren. And then she said, there's a problem. And it's not, I keep on hearing that. And I attribute it to the food that we are eating now. Because the young couples, you notice them even in the morning, McDonald's, you
make a very good point, actually, because I mentioned about sort of BMI as well. And this is why, I don't know if you remember, but back in the day, Jamie Oliver came on the scenes because of school dinners and all these things. And because we were worried that our sons and, the kids at that time, that obesity was becoming a problem. And recently we went to the US as well, and we realized that compared to 10 years ago when we went to the US, the McDonald's burgers were like this tall, the drinks were like this big, but they're cutting down on all these things and the sugar intake, and because of obesity. And actually, you're right, the fast food, not only does it cause things like diabetes, but also causes things like obesity, which then affects the heart. And if you think about the male ejaculation, it's all dependent on how good your heart is, because essentially your heart pumps the blood, which then makes your penis ejaculate. And not ejaculate, but stand up. I can't remember the medical term for it. But it's pardon?
Correct.
Yeah, that's the word. Thank you. Erect, yes, which then makes sure your penis erect. So essentially, if your heart's not working properly, blood's not getting pumped to the right places, you're actually going to have erectile dysfunction. So essentially, these are some of the things that we don't think about in terms of how we're eating and stuff. But when you mention Indomie, Auntie Amma, I just want to say if Dr. Kojo was here, because Dr. Kojo's favorite food.
Myself, I was about to be like, Auntie, where you are going with Indomie, I don't like it. Because
I mentioned Indomie. It's not Auntie Amma.
It's not me, but I mean, I agree because the Indomie is just, I don't know. Well,
no, you're absolutely right. It's just
it's just too much, easy cooking. And my son, I taught him how to cook. He's in the university, but because he knows that I don't like him eating. So he's always at home every weekend. So
Dinah, I think it was the same with in terms of the Indomie. I like Indomie very well, but I tend not to use the spices that they give for the Indomie. I'm a bit. So I take but even that, the Indomie in itself,
Indomie itself is basically carbs, and yes,
yeah. Not even the way it's processed, because the way that
it's processed,
chemicals that's used.
Others will add sardine, add eggs, and corned beef and all stuff. Not even veggies.
Yeah, well, I add veggies.
Corned beef anyway, protein into you.
No, but corned beef is processed meat, which is not very.
I mean, corned beef is not the perfect, but eggs is good.
But get off it. Come off it.
or try to or convincing. Or convincing.
Right? But you say you're having discussion.
I mean, when it comes to food, I mean, we don't take it seriously, but I feel for this generation, I must confess to everyone, because our eating habit is so bad.
Yeah.
And it's like I norm be into I mean, it's so sad. Even parents are ordering food outside to feed their family. And it's the time you woman you're busy. I was more busy when I was working. I didn't even have eyes, but I will cook every time. So I mean, if we know what food does to our bodies, I think we'll really rethink and then do the right thing, because I don't know. Yeah, breastfeeding, Didi, Papa, look at even the things that we've gone through. And then what they are doing. I mean, I tend to go to the hospital for appointments, and I tend to go to St. Thomas's. And when I see the children, oh Lord have mercy. Sometimes I come back home, or when I see them, I feel. I mean, who were the local used to?
Yeah, I know.
When you go to you will see a child. Some are being so pale. Say, you think so? What is going on? And there is, I mean, maybe where I go to, because I think I go to the eye department, so I tend to see the Evelina kids, and there are a lot of children, and then you ask yourself, what's going on?
Yeah. I mean, we could talk about this forever, Auntie Amma.
Sorry to cut you, but looking at the time, and we've got some questions coming through.
Oh, please. I thought nobody wanted to ask anything.
Oh, no, we've got a hands up here. So
okay, please answer them.
But thank you very much.
Thank you
for your submission, as always. Please, Susan, can we please have your submission?
I think the Clomid medication, it's not like everybody that's giving Clomid. I'm not too sure about this, but I think there are certain, out of the findings they get, there are certain people that might be put on Clomid. So I don't think it's a generalized treatment with Clomid being involved. Yeah. And also, Dr. Akos, I joined at the time you were talking about the everyday sex, so I joined midway. Wanted to ask, some people have the assertion that the everyday sex decreases the, should I say, the power of the sperm, or the potency, the potency of the sperm. Is that true for a trying couple? Is it true, or is it
Not necessarily. So if I see where the logic is coming from, but in a normal sort of sperm producing male, there are millions of sperm made every hour, literally, in the testes. And yes, as much as the more that the more that you have sex, and I think I know from some people have said this again in the past, that they find that if they've abstained from sex, when they ejaculate, the volume of the sperm is more than usual, than if they've been doing it more regularly. But the point is, even if the volume is more, with each ejaculation in a normal sort of sperm producing person, you should have more than 15 million parts of sperm. So even if the volume is going to be less, the number of the right sperm should be there. And the reason we say regular sex is important is because every woman is different and every cycle is different. So no matter how well you think you're tracking your cycle, sometimes your app will tell you that you're menstruating today. You realize that your menstruation comes in 2 days' time. So if your app tells you you're ovulating today and you think, okay, today's the day to have sex, before you know it, maybe you ovulated 2 days ago or you're about to ovulate in 2 days. So you've actually missed the window. And this is why we say when you're actively trying, you have to have sex on a daily basis. Obviously, aside if the woman is menstruating, is actually actively bleeding, because then it's kind of pointless. So I guess you get a bit of a break. You get like a 1 week break from it. But if you're actively trying, it has to be every day. So yeah, I guess my answer to your question is yes and no. Yes, it might decrease the volume, but in terms of the potency, no, because the amount of sperms standard should be more than 15 million in a normal producing sperm anyway.
Thank you very much.
Excellent. I've got another question in there by Colby Prince. So I'm in my early 40s and find it difficult to hold weas as soon as I feel to visit the bathroom. Is there any health condition? Male.
And Olivia has literally given. So initially, when I saw the question, I thought it was female. So I was about to be like, pelvic floor exercise. Then I saw Olivia's reply, and I was like, but Olivia, this person's a woman. So I went up to check the comment again because I was like, prostate in woman. Then I literally went up to check again, and I realized that right at the end, he's put I'm a male. So I was like, actually, Olivia's right. So the first thing that we worry about if you've got urinary frequency is that you've got an enlarged prostate. Now, I think I've talked about prostate here several times, and Dr. Mustafa also did a session on prostate back in September. But we will do that this month again because it's male month. So for those who missed it, so if you have a friend, tell a friend to tell a friend, we will cover the prostate probably next week. But yes, this is important because the reason the prostate, you pee more when you've got an enlarged prostate is because if you think about your urethra as a tube like this, your prostate is, you can't really see me very well. Your prostate is gathered around the tube like that. So when the prostate gets larger, it squeezes your urethra, which means that number one, when you pee, you don't fully empty your bladder because not all the pee is able to come out at once. Number two, that means that you have to go frequently because your bladder gets full easily because you're not fully emptying your bladder because there's that narrowing of the tube there. So if you've got urinary frequency, usually we would say check your prostate. That's the first thing to do. Sometimes they will do something called a DRE, which is a rectal exam. My advice to every male here is that if you go to your doctors and the first thing they want to do is a prostate exam, say no. You want to have the PSA test first. The reason I say this is because when you do a digital rectal prostate exam, it does not, it can confirm an enlarged prostate, but it does not rule out the fact that you could have something like a cancer there. They still have to do a PSA test. If you've had, thank you, Alexa. If you've had a DRE exam, this can falsely higher your PSA test. So the normal way which it should be done is you should get a PSA test first and then get a digital rectal exam. So you should still do the rectal exam, just that you should get the blood test first. So this is my advice to every male here. If you go to your doctor, they've not done a PSA blood test and they want to stick their finger up your bum, say no. and say, do my blood test first, and then I'll let you do that to me. If not, you get it done twice, which is annoying, number one, and it's not necessary. The second thing is, if it's not the prostate, another thing we worry about is sort of a urine infection. Kind of the second kind of third thing. Then we also worry about diabetes, because we know diabetes. So these are all the things that you will check. So when you go to your GP, you'll get a diabetes test done, you have a urine dipstick done, and you have a prostate blood test done. These are the three things we need to rule out. So the question you asked me is there a health concern? Yes, there is. Go to your GP, get all the relevant blood tests done. And then if they all come back and they're normal, then it's probably just pelvic floor, which means you just need to exercise your pelvic floor. Otherwise, Bobby, you can't do that unless you've checked it. So please check it first.
Thank you, Dr. Akos. Apologies as I drink my tea. It's
a cold night, understandable.
Very cold. Would like to go to Comfort.
Hello, thank you. Thank you, Doctor. Brilliant presentation as always. Thank you. Just a quick one. I know that if a lady has a short menstrual cycle, then they are encouraged to have sex, if they want to get pregnant, they are encouraged to have sex getting to the end of their period, meaning that they may still be bleeding a bit and they may menstruate. Is there a new evidence, or that still holds?
As far as I know, it still holds. So when you say getting to the end, so they might still be bleeding, but they might actually be ovulating while bleeding. Is that what you're saying?
Yes.
Yeah, so that's true. If a lady has a cycle less than 28 days, so I know some people have cycles for like 23 days or even less than that, then what all that means is actually as you're bleeding, you could also be ovulating simultaneously. And this is why we always say don't be fooled, because a lot of people who don't know this will say, oh, but you were on your menstruation when we had sex and this happened and then you still got pregnant, so the baby's not mine, all of that kind of stuff. People very quick to sort of judge and say no. But a woman's body is every woman is very unique, and each cycle is very different. Even this month's cycle can be very different to last month's cycle. So this is what I mean by you cannot, no matter how much you try to predict. And yeah, some people do have a very, very straight cycle. Like I know somebody who's, if their app tells them they're starting menstruating today, they'll start today. If the app says, that you're like, it's very bang on point. But even in such a person, there might be that one day that something changes and you don't know. The thing is, when you ovulate, you don't know. You don't know when it happened. You'll get the symptoms of it, but you actually don't know exactly when the egg was released. So I guess I'm agreeing with you and kind of answering your comment in a way to say that, yes, you're right, which then also means, and this is why I mean having sex every day. So if you have a shorter cycle, be more inclined to actually even have sex on your menstruation, which is, I think, which you brought up here, because you never know that you might actually be menstruating during your ovulating during your menstruation.
Yeah, thank you.
Thank you, Comfort. Back to Amma, do you have your hands up, or this is from previous?
Yes, I wanted to just add to, or maybe ask a question about, or add to what Dr. Akos said about weak bladders. Some medications to make people, wee a lot. Pregabalin.
Mm-hmm.
Yeah, so if you want some strong pain relief, it also makes you wee a lot.
Yeah, good point. I think there are some other factors out there, but I suppose we'll rule out sort of the medical causes first, and then we'll look at other things as well. But yeah, you're right. Even on a diuretic as well. So if you're on something like bendroflumethiazide or something like furosemide, the whole point of of your facial expression. But yeah, that those sort of medications can make
How are we ever expected to mention these?
So Bendro, usually people just call it Bendro, but it's literally, I struggle, but I've learned how to say it's bendroflumethiazide. It's a thiazide diuretic, usually used to treat high blood pressure. And there's another one called furosemide, which is usually used to treat heart failure, and there's spironolactone, another one used to treat. So there are some diuretics, and the whole point of the medication is diuretic is to allow you to pee. So so these kind of medications. But if you're on such a medication, I don't think you would be worried about peeing a lot, because you would know that that's the effect of the medication. So I suspect that you're probably not on those medications.
Excellent. Great stuff. I've got some private DM questions here, Doctor, if you don't mind. So
I've got one private as well. It says something about, does Clomid cause cancer? And the answer is it has a significantly slight.
Yes, it does.
Not significantly. Not significantly. So the thing about, so it has a chance of it increases your risk of ovarian cancer. And the reason why, so if you look in the chat, I think somebody mentioned that Clomid is not for everyone, but it's usually for people who do not ovulate. So the reason why you give Clomid is to encourage them to ovulate. Now, if you remember back when I talked about breast cancer, I talked about the risk factors of ovarian cancer is basically having less ovulations. So for example, if you have early menarche, sort of late menarche, which is late onset of starting to have your periods, or if you have early menopause, so the shorter time that you ovulate gives you a higher risk of ovarian cancer. So this medication is supposed to stimulate your ovaries, which means the more that it affects your ovaries in a way, which means it increases your chances of getting ovarian cancer, because it's forcing your ovaries to be overstimulated, which can cause overgrowth of ovarian cells. The risk is significantly low. So if you think about even other things, like we talk about the COVID vaccine having a chance of making people get blood clots and stuff like that, yes, there's a risk factor there, but there's a significantly low risk factor if you think about the pros and the cons. So yeah, just a quick snapshot. But Auntie Amma, yes, it does have a chance of, you're like a cancer specialist.
Well, thank you. Let me just, so quite a few here, but looking at time,
I think our host has another show at 9:00, so we need to, and it's 9:06. So if we can quickly wrap up.
Oh yeah, so yeah, let's just maybe I'll ask these two together because I think you can answer them. One, can masturbation cause infertility, and what steps can young men take to protect their fertility from early on?
Can I decide not to answer this question?
Why?
So, well, from a Christian point of view, obviously not like I feel some type of way talking about masturbation, because from a medical point of view, it's not wrong. And no, it doesn't actually cause infertility. From a medical point of view, it's actually encouraged because it actually promotes it promotes non-infertility. I don't know how best to put that, because if from a medical point of view, if the more you sort of ejaculate, the more that you you're putting your sperms to work, and you're the more that you encourage your body to create healthier sperms and things like that. So actually it is encouraged from a medical point of view. From a religious point of view, however, being a Christian myself, it's not something that I will encourage. So I don't know how to answer this question, even though I have kind of answered it, but I'd rather not answer it.
Well, thank you. I know it conflicts your your beliefs, and thanks for answering it, but obviously we will deal with the medical aspect on this show. What steps can young men take to protect their fertility early on?
So I talked about the environmental factors. So if you smoke, stop smoking. If you drink alcohol, cut down. I mean, occasional drinking is probably the best. Don't drink alcohol on a weekly basis. Drink it during Easter, birthdays, that sort of thing. If you have a high BMI, exercise and live in a healthy lifestyle. And I talked about some vitamin supplements to take. So things like vitamin C, vitamin E, selenium, zinc, these sort of things, just making sure that you actually have a healthy lifestyle, a balanced diet. All these things will encourage you to have healthy because if your body is healthy, you're going to produce healthy stuff. in a way, it's the same with women. The more you eat, the more blood you have, the redder your blood during menstruation, the healthier your baby. So it's things like that. So you really just want to live a healthy. And I think some of our aunties have already mentioned on this show that in this day and age with fast food, we're always rushing out of the house. We don't have enough time for ourselves. Instead of having a balanced diet, we're eating Indomie morning, lunch, evening. That's not a healthy diet if you're trying to have healthy babies. So really just paying attention to our health, and it is going to encourage sort of healthy production of semen and everything else.
Thank you very much. We have got a suggestion from Olivia who says, can you please come and talk about hernia in women? Yes, Olivia, we will do that. This month, we are trying to focus on men's health as it's Men's Health Awareness Day. So for the next 4 weeks, you will probably get topics that relate to men particularly. But
I will talk about hernia
in women is something we can schedule to talk about.
I will talk about hernia in men, and I will touch on it. So if you come and ask a question during that time, I'll be able to answer it for you.
And our host has arrived, and I think it's time for us to go. So
just before we go, I want to say
we'll just do a close up. Again, thank you everyone who for joining us.
Pacho, before your close up, I have one question, but Dr. Akos can decide to answer this one maybe next week. From my mathematical point of view, we have 30 days in a month. Let's say 30 days in a month. And I know some women are saying because of Nkwalano, Juma, until let's say 30 days in a month, now or yet 2 times in a week, which is 8 times in 30 days. Into 8 over 30. Okay,
wow.
You answer me next week.
What a mathematical question. 8 over 30, they would have made family calculation, but they answer
next week. Or no one who's our simultaneous equation. It's as a mathematician.
8 over 30, 26% were failing because at least you have to be hitting 50%.
But Jenny, catch our worry for the mommy.
It's 15 minimum 15 to be hitting 15 a month.
Awesome. But I'm not gonna round up because I think I've said everything today, so we'll just quickly, but thank you so much. Auntie Liz me who say ciao. Naomi who say we're so by my friend is saying, what's that guy's name, Abuna?
Jonas.
Naomi's raised her hands. Could you please, Naomi, speak but wrap it quickly?
I was not sharing.
Naomi? Okay, Naomi.
My Rashi kakra because until the Auntie Naomi.
And then I am so lucky on my age now.
The photo. Dr. Akosua was the only host in Tina. She was presenting, and it was just it was a technical.
I'm sorry, it was my fault.
The next time, most of the time,
and I wear the dibim. Nampacho Dr. Akosua way. Hey, Nana Mama dibim way so. What couldn't make it today.
Dr. Kojo Oko leave kakra because baby on ejuma winter time very very crucial because it's a winter in women's health. Winter is cold, so the women usually want to get more appointments. So
because I'm Canadian and the life question.
I've been not serious any mathematics no as a year juma.
Okay. I want you
Thank you all for coming. Before you go, we just want to say right on here on this platform, we have cloud engineering, developing marketplace skills. We have a professional, Prince Boache, who's going to talk to us about cloud engineering and how we can develop develop our marketplace skills. It's going to be very informative right now, right here. So if you have time, please don't go anywhere. Stay back and join us as we join this professional to help us develop our marketplace skills.
And thank you all, and see you next week. And remember, bring a man. Everybody should bring a gentleman to
bring a man
as we are having Men's Health Talk Show. Now have a good evening, everyone, and see you next week. Stay behind for the show, but see you next week for the Health Talk Show.
And to tap for my say situation I'm a cool and yes, I said mobile firm through na bibi abe boko. Now so yeah, customers need the idea. In fact, and yeah, the idea, but mama a holiday. Inti ye better must for this 1 month holiday amodi amaye. It's as a yasumaju and kakra. Ye excuse obi fra. They can say tap for problem. So until say problem no be sort in a 8 minutes and bibia. Man tie that must for the holiday. Even though say the pay na abano. Entity one and two more. But situation bi amuko bia no. Ye try say mobeba na ya start to adwuma so say this here no. I start with tap. Thank you.
Tap send. Papa no.
Yo, abusiafo anwumre yi so nyame wae adom odien ahyiemu a na nadom arakwa sabre amene okasa ide dwumadie a mede ebro no mini Cloud Rock for na eba betwetwe enkomo ene ohwe ye marketplace na IT na sabre ide dodo na omo ye adwuma ewo honoma omo egi musika na eno na ye nua beri man a wabie Cloud Rock no se obefa ato no ho so na ye nua no Ghana fo wabo ho dawro de akire ye nyina se de ebeye a yenso yebehu na yetimi enso de ye ho age IT ni mu na enfaso a ewomu no yenso yensa akabi enite na nwumre mede ora Prince Boache any Cloud Rock Academy team no at the bro na ye ba betwetwe nkomo a ye twetwe enkomo about cloud engineering ye ka cloud engineering na eno any dey eno any enkomo a sabri mini ora Prince Boache ba betwetwe Prince, a very good evening and welcome to the show.
Thank you, Nana Kwame. Hey, and I'm my friend Nana Kwame. I am a Cap Prince.
And they say, Nana Kwame ne yaji, you need to know the young fan. Good evening.
Prince, wake up. Good evening, everyone. Me hope you so be at here.
Yo, Prince. And then you radio say na yetai shiemu Thursdays, but and then the about Wednesday. Na it's possible say ABA will be in Shia Jumadi Eda. And into Obeda who edi kakra edi ache and say can ora Prince Boache, CEO of Cloud Rock Academy. Or no anyway.
Okay, yo. Me mobia me chao bia.
No, I don't know. Simple.
Na you can't Prince Boache me more into IT. My for a while. And me botaye uhumi me botaye ne se me pese enipa bebre esua IT. Me machire nkofo bebre nea me hunu ne se IT ba bia enipa betimi enya sika pa ena enye dene nso se usua ba on se ye dia hye ya adwene mo se edene ete se masa on the mass me kire me madi hu se mass na full school da bia me ka kire me na for se aden ye nya obi ama na nchire ye mu ye sa na IT nso te IT nyɛ dene adeɛ IT te sɛ wo kaka sɛ wobɛtumi aka kaa wobɛtumi ayɛ IT so wotumi no aduane na da bia wotumi de nkyene ne gum wodi moko ne gum consistently because nyɛ fɛ one day na adesua ayɛ nti sɛ wobɛtumi ayɛ a wobɛtumi ayɛ IT ntumi botaeɛ a mede asi m'ani so ne sɛ mɛkyerɛkyerɛ mu ama especially Ghana for ne bibifoɔ yɛhunu na yɛn nso yɛabɛyɛ bi once at times wohwɛ bi a India for ne wei a ɔmu di yie paa ba wohwɛ majority ɛyɛ IT na ɔmo yɛ nti yɛ baabi a yɛn nyinaa nso bɛtumi aba hɔnom na ade korɛ wɔ hɔ a ma ɔmu di yie wɔ baabi ɔmu wɔ bi a yɛn nso yɛnya saa di yie ne bi nti yɛbɔ taeɛ a yɛde asi nti wohu mi a wura Prince Boakye deɛ ne bɔ taeɛ ne sɛ ɔbɛbɔ dahuro akyerɛ amansan sɛ ehu bi a yɛde ahyɛ yɛn mu da about IT ama nipa bebree adwane afiri ho no ɛnyɛ nokorɛ mewɔ ha sɛ mekyerɛkyerɛ nkɔɔfoɔ sɛ wopɛ sɛ osua nko a na w'ani abere a wobɛtumi asua ɛho hia sɛ wobɛyɛ obi a w'ani gye IT ho ba woyɛ obi a w'ani gye sɛ wopɛ sɛ wonya sika deɛ a anaasɛ wonya career bi a it's for the future then mewɔ hanom sɛ mebɛkyerɛkyerɛ mu akyerɛ wo and Manuesi.
Thank you, Prince. I know sometimes I'm not but over anything. Thank you very much. So, you've talked about yourself. Let's talk about Cloud Rock. Cloud Academy, and so any day. Any matisse, any Cloud Rock Academy for boa, yema minum, yenuanum, yenese for doctors, lawyers, and your career into the IT field. Talk to us about Cloud Rock.
Okay. As a mechanic first note, the aim of Cloud Rock is to help everyone, mothers, whoever. If you look at our record, we've taught stay-at-home moms, we've taught delivery drivers, all sorts of people. Women. We currently I have 2 people working who are like, one is a lady, like 56 or 50 something. Like, so our aim is that we want to make it clear to everybody that if you really want to get into the IT space, it's open. You can do it. We can teach you only if you are willing and you are ready to learn. Do you understand? We are willing to help you, hold your hand step by step for you to become an engineer. And it will surprise you yourself. So that's our aim. Our aim is to teach people to become engineers, is to make it clear to people that it's not that difficult. Technology is not difficult as it seems. You know, to Cloud Rock Botaino, you training call for Mumbai engineers and over and over and over. It doesn't matter your background. We don't really even care about your background. If you are willing and you are ready to sit down and learn and listen to my instruction, me bachelor step by step, me click it now, so I click it, me click it now, so I click it, and ne call into Cloud Rock Botaino to help people, and also your Botaya back and say it's honum emate IT no. Me Botaya back pass ye be ye free honum no bia etimi akoyebi. As I say no, it's Ruby Daho, Ubiati and Yamashino. And no near Pessy ye sad the crona many payam shoe more IT hono, every honum. Send ye baby before, especially Ghana for yin I yet me a come near Koyebini a D. Because you shall ask me kind is and repeat it. If India for any other echo for Omu D or IT hopper, Yans so ye bet me a D any be. To Cloud Robotai no. So be up society be a bra. Ye beboa mosia.
Yo, that's a pa. Yo, na any ye can't about cloud engineering, DevOps. You can't cloud engineering na. And no any day will be a one DevOps that will be on cloud engineering that. And no any day. Na day inti and so any ushini padodo na almost some career going into IT.